So if you've been told you might need knee replacement and you're not ready for that, I want to talk to you for about the next 10 minutes. I'm going to tell you something that most people in my position won't put on camera. I'm going to tell you who these treatments don't help. I'm going to tell you when a knee replacement is actually the right answer. And I'm going to tell you that if you're not a candidate for what I'll do, I'll say so directly to you in my office. It's the reason I can afford to be that honest. I'm an orthopedic surgeon. I've replaced knees, but I also do regenerative medicine, the injections and the non-surgical options. I do both, which means I don't need you to be a candidate for either one. If all I did was surgery, you'd be right to wonder whether I see replacement in every x-ray I look at all day. And if all I did was injections, I have no reason to ever tell you that you've moved past what injection can actually do for you. I don't have that problem, so let me just tell you how this actually works. My name is Blake Ohlson. I'm board certified orthopedic surgeon here in Mount Pleasant, South Carolina. I've been practicing here since 2007. And almost everybody who comes to see me about a knee says a version of the same thing. It goes something like this. I can't play pickleball. I can't play golf. I can't do the traveling my spouse wants to do, and I don't want surgery. My knee hurts, and somebody told me I'm going to need a knee replacement. Now notice what comes first in that sentence. It's not the pain, it's really the pickleball, it's the golf, it's the trip you two have been planning since before you retired. That's the actual problem. The pain is just the mechanism. And that changes the question, because the question isn't how bad does my knee hurt? The question is, what did I stop doing and can I get it back? Those have completely different answers, and most people have never had anybody walk them through the second one. So let me explain the thing that usually got left out. Somebody looked at your x-ray and told you might need knee replacement. Well, that's probably true, but maybe it was incomplete. You see, arthritis is not a light switch. It's not an on or off. It's not good knee, bad knee, fine, or knee replacement. Arthritis is a staircase, a series of steps. Where you are on that staircase determines what's actually available to you. See, we grade knee arthritis on a scale. In plain English, there are approximately 4 steps. Step 1, barely anything. Maybe some pain, but there's plenty of cushion left in that joint. Most people here have never been told anything about a knee replacement. Step 2, mild. Space in the joint is starting to narrow. Maybe some small bone spurs. This is usually where somebody first notices they've quietly stopped doing something that they used to do often. Step 3 is moderate. Now there's clear narrowing of the cartilage on an x-ray, more spurs, some changes in the bone itself. Stiff in the morning, sore after you've been on it. It's affecting what you're willing to sign up for on a Saturday. And step 4 is bone on bone. The cushion is gone, left the building. This is what most people mean when they say they were told they need a knee replacement. So there's a reason I'm spending time on this. The treatments I'm about to describe work differently at different steps. It's not a sales caveat. That's the actual biology. And if you don't know which step you're on, you can't make a good decision about your knee. You just can't. You're guessing. So if you take one thing from this video, find out your stage. Not from me, not from a video, but from your own imaging. All right, let's walk through what actually is available. I'm going to include things I don't provide because if I only told you about what I sell, this would be a commercial. First are the basics: activity changes, weight management, anti-inflammatories, bracing, physical therapy. I know you've done some of this. Let me ask you one question. Did you actually do a real targeted physical therapy for an arthritic knee? Or did you do 6 visits of general strengthening, plateau, and quit and say it didn't work? Those are not the same thing. And the second one is much more common than the first. The muscles around an arthritic knee take on a real share of the work that cartilage isn't doing anymore. That's not a consolation prize. That's mechanics. I've seen a lot of people written off after a bad experience with therapy that wasn't built for their problem. Second's cortisone. Reduces inflammation. It works fast. On the honest limit, it's temporary, causes elevation of blood sugars, doesn't last as long each time you do it. And there's some ongoing discussion about how it breaks down cartilage with multiple injections over the long term. Cortisone treats inflammation. It doesn't do anything about why the inflammation is there. For a lot of people, it's a reasonable tool, but it's a bridge, not a destination. Third are the gel shots, hyaluronic acid, meant to supplement the lubrication of the joint. Evidence on these is mixed. It's relatively safe. Some people get real relief and some people get nothing. Professional guidelines are not uniform on it. I mention it because you should know it exists and know the evidence is somewhat debated. Fourth is shockwave therapy. Focused acoustic energy applied to the tissue, aimed at stimulating blood flow and your body's own repair signaling. Non-invasive, no downtime. I usually use it alongside other things than just itself. Fifth is PRP, or platelet-rich plasma. We take your blood, we concentrate the platelets out of it, and we inject that concentrate directly into the joint using ultrasound so we can see exactly where it's going. You see, platelets carry growth factors, and they're part of your body's normal healing signaling. The goal is to influence the environment inside the joint. Now here's the part actually I made this video for. PRP is not for everybody with a bad knee. And let me tell you who I turned down. If you're bone on bone, step 4, stage 4, you're not going to be a good PRP candidate. If the cushion's gone, PRP is not bringing it back. I want to be very clear about that. Anybody telling you an injection regrows your cartilage is selling you something. Number 2, if you got significant deformity, if the knee is shifted, deformed, bowed, in or out, an injection doesn't fix alignment. That's a structural mechanical problem driving the damage. Treating biology and ignoring the mechanics doesn't work. Number 3, if you've got uncontrolled medical conditions, diabetes, active infection, certain blood disorders, I'm going to want to know that that was addressed, because your healing response is the real treatment here. Your body's the drug, and if the system isn't working well, I'm asking you to do something it currently can't do. And if you're expecting a brand new knee, it isn't one. If the goal is to be 25 again, I'd rather disappoint you right now for free on the internet than take your money. I know that's a strange thing to put in a video meant to bring you patients, but you've already seen the ads where everybody's a candidate and everything works for everyone. If you're going to trust me with a decision this size, I think you should first watch me turn business away. I also want to say this clearly because I mean it. Sometimes a knee replacement is the right answer. Sometimes it's the best answer. It's one of the more reliably successful operations in medicine or orthopedic surgery. If you're bone on bone, you're in pain all the time, you're not sleeping, and your life is narrowed down to the distance between your chair and the kitchen, I'm not going to sell you an injection to postpone the thing that would give you your life back. I'll tell you that too. But here's the last thing, and it's the one I'd want you to hear if you were my family. A lot of people get told to come back when it gets bad enough. Well, that advice isn't wrong. It's just incomplete. Because waiting is the decision too. That staircase keeps going whether you like it or not, whether you've decided to do anything. And the options you have on step 2 are not all the options you have on step 4. I'm not saying that to scare you. Plenty of people wait, do fine, and have a good replacement later on. That's a legitimate path. I'm saying it should be a decision you make with real information, not a default you got handed because the appointment was over. So here's what I do if I were you. Number 1, find out what step you're on. That's it. That's the whole first move. You can't decide anything without knowing how severe the arthritis is. If you're on step 1, 2, or 3 and you're still active and somebody told you to just wait, you're exactly the person I'd like to talk to. There's usually more available than you've been told. If you're bone on bone, you may not be a candidate for what I described today. There may still be things worth discussing. Come find out which ones. And if you're miserable, please don't spend 2 more years and a lot of money trying to avoid that thing that would actually fix it. I'm Blake Ohlson. My practice is Sports Medicine and Orthopedic Centers in Mount Pleasant, South Carolina. If you'd like the longer written version of everything I just covered, there's a free guide linked below. No cost, nothing required. And if you come in, bring your imaging and bring your spouse. This decision usually gets made by 2 people, and the trip you're trying to take involves both of you.